Symptoms of Human Immunodeficiency Virus. HIV attacks the body's infection-fighting immune system. Without treatment, HIV can lead to AIDS, acquired immunodeficiency syndrome. At the start of the AIDS epidemic in the 1980s, people who were infected with HIV quickly progressed to serious disease. But today's treatments help lower the amount of virus in the blood so people who are HIV positive can live healthier, longer lives and not necessarily progress to AIDS. Within a month or two of HIV entering the body, 40% to 90% of people experience flu-like symptoms known as acute retroviral syndrome, ARS. In the early stages of HIV infection, the most common symptoms are none. As many as 1 in 5 people in the United States with HIV doesn't know they have it, according to the Centers for Disease Control, CDC. That's why it's so important to get tested, especially if you currently have or have had unprotected sex with more than one partner or use intravenous drugs. Here are the most common signs. Fever. One of the first signs of HIV can be a mild fever, up to about 102 degrees Fahrenheit. The fever, if it occurs at all, is often accompanied by other usually mild symptoms, such as fatigue, swollen lymph glands, and a sore throat. At this point, the virus is moving into the bloodstream and starting to replicate in large numbers. As that happens, there is an inflammatory reaction by the immune system. Skin rash. Skin rashes can occur early or late in the course of an HIV infection, and can even be a sign of AIDS. Nausea. Diarrhea. Between 30% to 60% of people have short-term nausea, vomiting, or diarrhea in the early stages of HIV. Weight loss. Weight loss is a sign of more advanced HIV infection and could be due in part to severe diarrhea. A person is considered to have wasting syndrome if they lose 10% or more of their body weight and have had diarrhea or weakness and fever for more than 30 days. Nail changes. Another sign of late HIV infection is nail changes such as clubbing, thickening and curving of the nails, splitting of the nails, or discoloration, black or brown lines going either vertically or horizontally. Yeast infections. Another infection that's common in advanced HIV cases is a vaginal yeast infection, caused by an overgrowth of Candida, a type of yeast that naturally live in the vagina. It's a very common fungus. The yeast tends to appear in the mouth or esophagus, making it difficult to swallow. Cold sores or genital herpes. Cold sores, oral herpes, and genital herpes can both be symptoms of HIV infection. Having herpes can also be a risk factor for contracting HIV. This is because herpes can cause ulcers that make it easier for HIV to enter the body during sex. Tingling and weakness. A lesser-known symptom of HIV is numbness and tingling in the hands and feet. This is called peripheral neuropathy, a condition that also occurs in people with uncontrolled diabetes.